All right, y'all, so here we have an os coxa, or a hip bone. This is a left os coxa, and what you're looking at is the acetabulum right here. So this is a lateral view. And then if we flip here, this would be an anterior view. We would see the pubic symphysis here in the front. We have the ASIS right here. And then from a posterior view, we see the ischial tuberosity and the posterior superior iliac spine, or the PSIS. This is an oddly shaped bone, and it's formed from 3 bones that are fused together: the ilium, the ischium, and the pubic bone. And you can see that separation here with these black lines as well down here. And then all 3 help to form the acetabulum. All right, so let's get started with its attachments. So it attaches to the sacrum with the auricular surface here, and that's going to the auricular surface of the sacrum. You can see that attachment right there. And then it's going to connect into the other os coxa bone anteriorly at the pubic symphysis. So you can imagine that connecting right there, and you can see that here. And then you're going to have the femur attaching in the acetabulum. So the femoral head is going to go right here, and you can see that here. Next up, let's talk about the structures on the ilium. So we have this auricular surface like we talked about. We have the gluteal tuberosity, which is this entire roughened area right behind the auricular surface. Then we have the posterior superior iliac spine. It's a big doozy, but posterior because we're looking at the posterior surface, superior because it differentiates it from the inferior iliac spine. So posterior, superior, iliac, so this is the ilium, so this is iliac, and then spine. So spine is just what they're calling this whole area. So then posterior, inferior iliac spine here in yellow. So PSIS, PIIS. Next we have the iliac crest, this whole crest. And then we have different gluteal lines. So these gluteal lines is the anterior superior gluteal line, the posterior gluteal line, and the inferior gluteal line. And if you look at a real bone, these can be really difficult to see. So sometimes these lines are almost more hypothetical and more defined by where muscles are located rather than an actual definitive line. Here we have the iliac tuberosity. And now we have an anterior superior iliac spine and an anterior inferior iliac spine. So ASIS, AIIS. And then here we have the iliopubic eminence. And here we have the line that separates the ilium and the pubic bone. Here we have the arcuate line. And then here we have the greater sciatic notch. When we look at the acetabulum, we see that we have the 3 bones of the os coxa forming together to form the acetabulum. So we have the ilium up here, we have the pubic bone here, and we have the ischium here. And this helps form the acetabular rim in the darker green here. Then you have the lunate surface, and then you have the acetabular fossa in yellow, acetabular notch in purple right here. And then here we have the supra-acetabular groove. Next up, we're going to go look at the pubic bone. So we said that this is the arcuate line, and that line kind of extends on the pubic bone, and this becomes the pectineal line. And then here we have the obturator line. Pubic crest is this whole area in yellow, where the pubic tubercle is this bump right here. Then we have the body of the pubis, the inferior pubic ramus, and I didn't color it in, but this whole area up here would be the superior pubic ramus. Then we have the articular surface for the pubic symphysis, and we have that separation between the pubic bone and the ischial bone, or the ischium. So now moving on to the ischium, we have the ischial ramus. And because it's the only ramus, don't need to say inferior here. It's just ischial ramus. You have the ischial tuberosity, and you have the lesser sciatic lesser sciatic notch, which helps form your lesser sciatic foramen, and then your ischial spine. And then back here, now we're kind of on a posterior view again. This is the separation between the ilium and the ischium posteriorly that continues into the acetabulum. All right, let's speed run this. So we're starting with an anterior view. Pubic crest, pubic tubercle, pectineal line, obturator line, iliopubic eminence. We have the separation between the bones. We have the body of the pubis. We have the inferior pubic ramus, all this superior pubic ramus, ischial ramus, ischial tuberosity, greater sciatic notch, lesser sciatic notch, ischial spine, supra-acetabular groove, acetabular rim, lunate surface, acetabular fossa, acetabular notch. We have the inferior, anterior, superior, and posterior gluteal lines. We have the iliac tuberosity, ASIS, AIIS, iliac crest up here, posterior superior iliac spine, posterior inferior iliac spine, arcuate surface, gluteal tuberosity,